Hi guys, I'm here with Dr. Unger. I invited him today just to chat a little bit about everything, what he does and skincare. We get asked a lot of questions, and sometimes we get asked things that I don't know how to answer and I don't know the medical technical way to say it. So what better way than to have the man himself answer these questions.
Hot topics in facelifting. And so I said, we should talk about this because it's something we hear about a lot. I get a lot of questions about it. There's a lot of Instagram chatter.
Yes.
Some clarification that can help your patients,
right,
my patients, and a lot of our mutually shared patients, right?
One of the biggest things we get asked is, what is a deep plane facelift?
Deep plane facelift, it's a technique that was basically pioneered in Dallas, where I trained at UT Southwestern. So I worked with two of the originators, spent a lot of time with this technique and all the various techniques. What it's referring to is facial rejuvenation, not at the level of the skin, which has been out of fashion for a very long time, but cutting
underneath. What do you mean by that?
What I mean is, in the 70s, 80s, when facelifting was kind of just getting popularity, people just take the skin, cut on it, and tug on the sides.
Okay.
That's why I always tell patients, we have the worst calling card out there because you only notice bad work. Right? There's been a lot of evolutions. We can go into the techniques, but what a deep plane facelift refers to is surgery below the deep layer of the face, or working on what's called the SMAS. S-M-A-S, it's got a long lengthy word. It stands for superficial musculo-aponeurotic system. That's not very important, but what it is important, it's the layer of the face that moves and has structure to it, that's above the layer of the nerves to your face. So what makes facelifting such an amazing but challenging surgery, if you're in the wrong spot, you can hurt the face and make the face not work. Those of us who do a lot of facelifts, that's a very, very uncommon complication, but it certainly is a possibility. And the deeper you are, the higher that risk is because the nerves are deep. I think what's important for all of our patients to know is any surgeon who does a lot of facelifts or does a lot of surgical facial rejuvenation will most likely be working on that deep plane of the face. Now, do I call my facelift a deep plane facelift? Again, because I train with the guys who created it, and I don't do their particular technique in total. I get to have bits and pieces of different things that I put together to create what works in my hand and for my aesthetic. I like to refer to my facelift as more of a dual plane facelift. Okay. Meaning I operate on the deep plane, so I can get the deep cheek mass, jowls, all that repositioned in the right spot. And then I take the skin, oftentimes in a different direction. Slightly different, because you might want the face, some people need more of a vertical elevation. Some people need more of an oblique elevation. But where the bulk of the face needs to go versus where the extra skin needs to come out aren't necessarily the same.
Is that what you did on me?
It is.
Okay, good.
Yeah. And so in you, we did a lower face and neck lift, right? Because we were mainly working on the lower third of the face and the neck. We worked on the deep structure, the SMAS, the platysma, the musculature of the neck, these guys that hang out as we age. We worked on all of those to elevate that deep layer both above and below it. So that's the deep plane. Pulling it and elevating to the right spot. And once I had the muscle and the deep face, I have, I'm looking underneath the skin and we're seeing the structure and the jawline and recreating all those highlights. Okay. Now I can take that skin and move it any way I need to give you the best contour and shape to the skin. Right. Because it's not necessarily exactly the same, right? I like to have a little more variable control. I do it a little bit differently.
As I feel like this type of deep plane facelift allows for the movement in the right areas because of the way it's being pulled.
I couldn't have said it better myself. We're trying to give, just like what you're doing with all your patients and how you customize their needs, their skincare needs, their plan based on their skin type, their tone, their texture, their Fitzpatrick. I'm doing the same thing. So it's not cut and pull, chop, 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 same thing every time. It's completely customized. And so I do that variable approach that allows me to really change it for each person. I want everyone to look like themselves, just a refreshed, rejuvenated version of themselves.
And I think that's why he and I have worked so well for a while, because our goal is, to enhance how you naturally look. We want to not change the way you look, but enhance what you naturally have. So whether it's good skincare and it's a little Botox and filler that's buying you time until you need the knife. As far as recovery with a deep plane versus a traditional facelift, what is it the same?
So I want my patient to recover quickly. That doesn't mean it's a small surgery, but it means the techniques we utilize, the way we want to pre-treat our patient's skin, the way we want to treat patients afterwards is all geared so that people can have a very, very fast recovery. If you do a very long surgery or it's very aggressive and very deep, that can tend to have more bruising and swelling, obviously.
Right.
Like to be very efficient but complete, and just make sure we have the right pre-op and post-op plan to get you back on your feet quickly,
Right,
because no one
right.
has time.
People ask me this a lot. When they do a facelift, do they sew in the ear or do they come behind the ear? Will I see the scars? And I'm like, well, I don't see anything. I don't know what you did, but can you explain, like?
Absolutely. So, that's a great question too. So I'll use your beautiful face as an example, right? So you can't see any scarring at all, which is really the goal. The goal is not a small scar. The goal is a well-placed scar that heals well, right? And so it needs to follow your natural anatomy. And depending on, people think a full facelift, another, misnomer. People think a full facelift means something up here.
Right.
And that's a forehead lift or a brow lift or a
Right.
temple lift. So there's no cutting up here in the facelift. But there is some kind of incisions, typically in front of the ear, as well as behind the ear in most cases. And there are various patterns, but what you want to do is follow the outlines of this. It's called the tragus. You want to be hidden in the hairline or hidden within the hair. You want to go around the ear lobule, keeping that natural shape to the lobe.
Okay.
Some people's lobes are connected, some people's
Yeah.
lobes are indented. You want to try to follow that and create the same shape. And then
Keep it neat,
almost
tied up
everyone,
the back.
right, everyone has an incision that goes around the back side of the ear here, and then into the hair or down the hair to some extent,
Okay.
because you need access to the neck.
Yes.
You need access to the whole cheek. So I always tell patients, you have to come around the ear, because if I want to operate and elevate this tissue here, you need to have access to that. Oftentimes in the middle of the neck as well, because there's musculature, there's fat, there's tissue, sometimes there's additional glandular elements that you want to remove from a small incision underneath here. And then eyes and brows are separate.
Right. Facial rejuvenation. This is something that we do all day, every day, and we are passionate about. And there are things that the patient can do at home, and then there are things that we do in the office. That can be a whole gamut of things. And so there are, from your standpoint in facial rejuvenation and having the skin ready for surgery, what are the things that you look for the most when the patient comes to you and they come to you and their skin's not so good, or the elasticity or collagen volume needs to be, what do you say?
Well, that's a great question, and I actually
Obviously you say come over here, but I'm kidding.
I leave. That's right. So we have a lot of patients we share together. We have patients in my office, in this office, and hopefully all of them get on kind of a prejuvenation
Right.
regimen. Right. You're not going to reverse 65
Right.
years of aging in 6 weeks, but we do want your skin to be moisturized. We want cellular turnover. We want your skin ready. We want the cellular signaling actually
Right.
there, so that healing is more rapid and you have as much strength and of course pigment control as possible. So
Right.
you've been a pioneer in that space, right? From your Koji pads, which are, I feel like the whole world uses. Just making sure that you have good control over texture tone, right? That's huge. And then getting retinoic acid or retinols involved to get cellular turnover leading up to surgery, and ensuring you have just the best moisturized, plump, healthy skin possible for surgery. Now, what you guys also do great, and we have, is ensuring that you do the little things along the way to help yourself feel more youthful, look better, because obviously not everyone's always ready for surgery, and surgery's not right for everyone
Right.
all the time. And so there's a lot of things that I certainly believe in too, even as a surgeon, that I think are important steps to take along that road of life and aging. Tell me about, because I know when a patient's coming to me who's coming from you, because I can always tell.
We've already had them in boot camp.
Yeah,
We've had them do
I
laser.
can tell. I see their skin. I start at the top and work my way down. One of my goals, like we talked about, is a very harmonious and natural approach to the face, which means, although I don't force everyone to operate in every part of the face, we always start at the top and work our way down from an analysis standpoint. And when I see your patient, and I start at the hair, I look at the hairline in the forehead.
And it looks like glass.
I like, oh, are you from Karee? I'm like, yes. I was like, well, your skin looks great. So
There's so many people that come in and they've never been on a retinoic acid. They don't even know what that is. We like to teach you, how it works. It's not about being on the strongest one. It's about being on one that you can tolerate, working your way up, finding something that, again, lifts the cells, creates cellular turnover, doing some laser and things like that help, help the collagen production and all of that, so that they can be ready if that's something that they need to do. But I do think it is this beautiful, like, harmonious thing, because you can't have one without the other.
It's all these little things that help. You know, it's the right regimen, it's the right care, it's the right sunscreen, right, first and foremost, sunscreen. And then, of course, it's all the more advanced and more aggressive things as we age and as we need more.
I'm thankful that we have these resources, so, you know, it's good to ask these questions we got on here tonight, just to share these things, because I know you all have a lot of questions to ask, and we'll share this. But if there's anything else that you want to know about and you want to hear from him or me, you know, this is what we love and do, and we want to get those, you know, we were happy to share all that information.
Not only is it taking care of patients, but also we both have a passion for educating patients, and so...
And we're making some people look really good out there.
Yeah, we just, it's just a fun opportunity for us to get the chance to chat with everyone and give some information, and we're always available.